There's ample evidence-based research which proves that patient safety initiatives consistently delivered year after year at every contact between the healthcare provider and the patient, that high cost in lives and dollars can be saved. Patient safety, when it's a priority for the entire healthcare team, as well as the patients they serve, will reduce the need for expensive drugs, extended hospital stays, and excessive readmissions. This improves the quality of care and controls the needless increases in the rising cost of care. Healthcare workers, from doctors to custodial staff, working collaboratively, need to make infection prevention their top priority. The report released today clearly demonstrates that if we make infection prevention and medical error reduction our top priority, from the Board of Trustees and the healthcare administrators to the custodial staff, working with patients and their families, we can achieve better care and reduce healthcare costs. Transparency in reporting of infection rates in every kind of healthcare setting is the key. Hospitals, healthcare centers, clinics, nursing homes, and physician offices need to be honest with patients on their efforts to eliminate infections, especially deadly ones like C. difficile. By improving the way care is delivered, including improvements so that patient safety is increased by reducing infection and medical errors, Massachusetts can and will lead the nation in curbing rising healthcare costs. In that regard, the Betsy Lehman Center for Patient Safety and Medical Error Reduction at the Department of Public Health needs to be taken seriously by those who craft the budget. It's a source of profound disappointment to me that neither the Romney nor the Patrick administrations has put sufficient resources behind the center or sufficient efforts to promote full reporting and prevention of healthcare-associated infections. Both governors call for curbing the rising costs of healthcare, and both have failed to put their money behind proven strategies to cut those costs and eliminate needless, wasteful medical errors. Better state funding of the Lehman Center would provide the leadership of for a more effective campaign using evidence-based research that can help to push healthcare providers towards safer, more cost-effective delivery of care. We in the legislature must also share the blame for inadequate efforts to reduce infections and medical errors. However, more than governors or legislators, the leadership needs to come from the healthcare providers themselves. When the CDC continues to report 150 years after the discovery of the vital importance of hand washing by doctors and nurses, that 40% of doctors fail to routinely follow that protocol, there can be no greater indictment of the profession. It is unacceptable for 40% of the, quote, healing profession to be more properly called harming professionals. If it were not for a few committed professionals, most of whom are actively engaged in the Coalition for the Prevention of Medical Errors as the beacons of patient safety, Massachusetts would be a far more dangerous place to be a patient. We know that the best practice is or should be what is the common practice, and I challenge everyone involved in healthcare to make it the common practice in every aspect of the delivery of healthcare in the Commonwealth. Neither the governor's healthcare cost containment bill, House 1849, which moves us in the direction of payer and provider rate setting, nor Representative Mariano's provider cost equity bill, House 3904, which would deal with provider charges, address the fundamental issue of patient safety in a consistent, evidence-based manner to reduce unnecessary health expenditures. In fact, by the arbitrary cost reduction factors in both bills, they're more likely to put patients at greater risk by focusing on cost-cutting and fails to encourage adequate investments in safety and quality, so that they're essential to, which are essential to long-term success in healthcare reform in the Commonwealth. Nearly 400 years ago, John Winthrop said of the experiment of Massachusetts in the New World that we must consider that we shall be as a city upon a hill. The eyes of all people are upon us. Especially in healthcare today, we remain that fabled city on a hill. The eyes of all people are truly upon our experiment in near universal health care. If we fail to control unnecessary, wasteful, often dangerous delivery of health care by failing to conquer infections and medical errors, we, as Winthrop warned the colonists at that time, shall open the mouths of enemies to speak evil, and shall shame the faces of many of God's worthy servants, and cause their prayers to be turned into curses upon us. We've already seen some evidence of that in the presidential campaign to date, and I suspect we need to make sure that we aren't giving any truth or comfort to what they're telling us about the rest of the nation about health care in Massachusetts. We have made some real progress in Massachusetts, but we still have a long way to go to really be the leader of the nation, maybe of the world, in health care quality and safety. I thank you all for your attention and your participation in this program, and I look forward to receiving the full report that has been prepared on C. difficile. Thank you.